Great.
All right. All right. Good afternoon, everyone. I see folks hopping on the line. So welcome to Tuesday, day 2 of our CSAAH conference. My name is Jennifer Wong. I'm a program manager at NYU Center for the Study of Asian American Health and your MC or your host for today's sessions. And just want to welcome everyone to our 11th Biennial Asian American Native Hawaiian Pacific Islander Health Conference. And specifically to this session 3, we're really excited to have all of our speakers here for the session titled Research Studies with National Reach. A few brief housekeeping notes. If you have questions for our panelists, please add them to the Q&A box at the bottom of the screen. The session is being recorded, and yeah, we will try our best to answer either typing it out or in response during the Q&A portion later during the session. So yeah, I also wanted to know that we have a special guest with us during today's conversation. Sarah Yukimoto Saltman is a graphic artist. We'll be offering graphic recording to help centralize and build connection with some of the earlier presenters and some of the things discussed on the session today to help frame key directions related to engaging communities. And she will share some of those final canvases after the event, which I will share with everyone who's attending. So then without further ado, I'd now like to introduce today's moderator for this panel conversation. Dr. David Takeuchi is a professor at the University of Washington with expertise in large-scale community and national studies that examine how race, ethnicity, and immigration are associated with health outcomes. I personally am extremely honored and pleased to share this space with him and our esteemed panelists today for what I think will be a very thoughtful conversation. So I will turn it over to you, David, and thank you.
Thank you, Jennifer. It's a pleasure to be here, and I'm excited to serve as a moderator for this illustrious panel. The conference organizers have really done a great job in bringing these trio of talented, smart, and innovative guests. The focus of this panel, Jennifer mentioned, will be on studies that have a national reach. The panel will be slightly different from more conventional panels in the sense that we will not have presentations with PowerPoint slides, but we will proceed with questions and responses from the panelists and encourage the panelists to have a conversation among themselves as well. We will reserve the last 10 or 15 minutes for questions and comments, as Jennifer mentioned. But before we get into the questions, I'm going to ask each panelist to just say something about themselves and introduce their areas of interest, and then we'll have a more in-depth look at some of the research that they're doing that has a national reach. So, Nia, can you get us started?
Yes, I'm Aitaoto. I'm a community researcher. That means I'm based in communities, but I do national and also local research in the U.S. Pacific, the 3 territory and 3 COFA nations, the state of Hawaii, and we do have a reach of 40 states here in the continental U.S. I'm still at the University of Utah, and then also NYU folks with dentistry, and then the University of Hawaii, John A. Bird School of Medicine. So that's the area where my partners in academic partners, but I also have other academic partners. So it's focused on community for the research. So I partner with multiple universities. So it's an interesting place to be.
Thanks, Nia. James?
Hi, I'm James Floyd. I'm a Korean American physician and cardiovascular epidemiologist, also at the University of Washington, like David. Yeah, so I'm out here in Seattle. It's rainy. We had our power out for almost 24 hours. So my research for actually almost all of my career has not been focused on Asian American health, and that's something I wanted to get into later during the talk if there's an opportunity. My research is broadly on causes of cardiovascular diseases, mostly on biological causes. So things like genomics, proteomics, things like that. And I've worked in a lot of the prospective cohorts funded by the NIH. And I'm on this panel in part because I'm one of the PIs of the coordinating center for the new Mosaic study, which is the prospective cohort study of Asian American, Native Hawaiian, and Pacific Islander health funded by the National Heart, Lung, Blood Institute. I'm really excited about that.
Great, thank you. Vanessa?
Hello, everyone. I'm Fornessa Randall. I am the director for the Center for Advancing Health Equity in Rural and Underserved Communities. That is a mouthful at Penn State College of Medicine, better known as KE-RUC. I am also the executive director for a nonprofit, the Asian Health Coalition. I'm a social scientist. I have the opportunity to serve as a PI and co-investigator for several federally funded projects. One as co-investigator on the Mosaic study, and also as PI for the All of Us research program as a community engagement partner.
Great, terrific, terrific. So let me begin by asking each one of you to give us a bird's eye view of your current research, especially around that has this kind of national reach, and tell us what's innovative about the study, either the infrastructure, the content, or substance that allows it to have this kind of national reach. And I'll start with James. And maybe this is a good time, James, to talk about how you got into doing research on Asian American.
Sure. Yeah, I can start. I mean, I kind of came up in my career working in these prospective cohort studies. So I think a lot of you know the Framingham Heart Study, and there are about 10 or so of these big prospective cohorts that really are national studies, and they're scientific engines where a lot of our discoveries about really the kind of basic risk factors for cardiovascular diseases have come from these studies. A lot of information on treatment targets, things like that. These cohorts have thousands of publications, and this is where people start their careers. When I was a postdoc, an early career faculty member, and these were the opportunities available. And I'm incredibly grateful to these studies and to the NIH and my mentors and colleagues. But one thing that was very noticeably missing was any kind of national NIH-funded prospective cohort on Asian American health, even though, this is the most diverse kind of racial ethnic group in the US, the fastest growing one of the largest. There just have not been opportunities. And one thing I've heard over and over from my colleagues, and that I felt myself, is I've always wondered why. I've always wanted to study these issues in these populations, but the same opportunities weren't there. Now, of course, there are amazing researchers like the panelists here who have been doing great work for decades on the health of these communities. But I think it says something when there isn't an NIH-funded kind of national effort. That says a lot about what people think about the importance of studying Asian American health. And over the last few years, for various reasons, there was enough political and scientific interest that the NIH dedicated a large amount of money to start this real national resource, which we've been working hard on for the past year, really just planning and starting recruitment later this year. And we hope this will be a 30, 40, 50-year-old study to study, I can't even list all the hypotheses. So, the things that we're starting out with, basic things like how much hypertension, how much diabetes is there, how much is undiagnosed, how does it differ by people's, country of origin or descent, their nativity, what languages they speak, different aspects of their culture, something that people often refer to as acculturation, but it is far more complex than that. But then all the students, the people who haven't started their careers, who have their own interesting hypotheses that merit study, this is really a laboratory and a platform for them to do it. So, we have a coordinating center and 5 really experienced field centers who have been working with their communities for decades successfully. But really, this study is intended to be a resource for investigators broadly, who aren't at these institutions. And that's really exciting.
That is exciting. Vanessa?
Yeah, so I think it's interesting when we were having this conversation before we had the webinar, we were all sort of talking and could have continued to talk probably for the last week and a half, on these various topics. But I think that the one of the studies that I am working on in PI for the national engagement for community engagement partner for the All of Us research program, I think the innovation around what we decided to do with this award was to, gather up partners from across the country, because even regionally, a lot of the populations that we're talking about have differences. There's so many differences regionally, and so it was important not just to have a perspective of the Chinese from New York, but also have it from Chicago, and have it from California, and have it from Texas, and or from the Korean, same thing. So really to see that we brought this network together of 25 organizations across the country in 45 states, including Hawaii, and to think that these groups would come together and would be able to educate people around the importance of biomedical research. All of Us research program, if you all don't know, the goal is to enroll 1 million people or more, and to retain them for biomedical research, and to provide genetic and genomic results back to them, and to be able to understand these populations better. And the focus is really on those who are underrepresented. Obviously, we're here today having this discussion because the API populations are those groups, and we know the numbers. We know that research studies are not generally focused on this population, and to a really large degree have been excluded from this process. And so I share the sentiments that James talked about, and really just believe that this type of conversation and this type of conference is really important to further the raise the elevation and the knowledge about the need for more studies like these.
Thank you. And Nia, you've been doing this a long time, so it must be gratifying to see the development of the field, to have many more researchers engaged, and more studies being done. So maybe you can share a little bit about what you're currently doing too.
Yeah, so what we're currently doing with the NAOPO, the National Association of Pasifika organization, is that the Piao Walawasa grant is actually unique in a sense where we're focused on social determinants of health, right? So the social intervention. So we're doing an intervention that actually the diabetes prevention program with Pili Ohana, which is a Native Hawaiian focused TPP program, and we're inserting classes on social determinants of health, right? So not just a side note, is actually an actual session. There will be like 4 of those in one cohort. So that's a unique way of doing it, and also the reach. So we're looking at a couple of sites now in the USAPI, like YAP and Pohnpei. We also have a couple of sites in Hawaii, and then one in Alaska, Oklahoma, and Arkansas here in the continent, right? So that's our first cohort, and we are planning on continuing that until we reach all the other different states. So on top of that, it is actually the structure. We have a multiple PI. So our academic partner is with the Department of Native Hawaiian Health at John A. Burns School of Medicine, Dr. Koholukula. And then we have 2 national community partners, which is Papa'ololokahi, national organization that serve Native Hawaiians, and then also the National Association of Pasifika Organization. And the co-PI system, where there's not just, voice and power on driving the research, but where money goes. So 80% of the money actually come out to community. And when we say come out to the community, is that we actually get our own budget directly versus going through the John A. Burns School of Medicine. So we have control of the resources, but also how the research is moving forward. And community, many times we want to do a research project like that, or, other things, but they're like, what about this? What about that? This funding opportunity enable us to do the second part of it. It's measuring determinants of health, but we want to focus on culture. culture is a social determinant of health, right? That we really want to look into, not just language, our matrilineal culture, the way that we look at death and dying and wellness. So, the way that we interact with each other. So there's no measure for it, but this study gave us the opportunity to gather people together to start looking at current measures and figure out what we want to measure next, right? And not just for our individual communities, but also figure out like how it's being measured on a national level and where can we fit, because we also want to compare it to, other folks that are out there. So that's the second part of it that's also very innovative, is for us to look at our own measure. The third part is for us then to look at creative way to train the workforce, specifically our community health worker, right? So we are going to develop curriculum to provide training not only on diabetes lifestyle coach or prevention education or whatever else. We're also going to build a training curriculum to train on how to do research, right? The process and all of that. What is research? Why is it important? But also the process. So it's very messy. It's the most beautiful mess you ever see in your life, but it's very, very messy, but it's something where community wanted for a long time. And it is a honor and a pleasure and, to be part of it. So yeah, that's what we're doing here.
Perfect. Yeah, I agree with the messy part, but it's fun. I wonder, in addition to the training and curriculum development, I was wondering from each of your perspectives, what other things do communities seem to want out of your research? And you're at kind of different stages of your projects, but what do the communities kind of engage you with in terms of what they might want? And what do funders seem to want from your studies? Vanessa, I'll let you start that off.
Yeah, I was just thinking that I was sort of feeding off a little bit about what Nia said, because I think that she really hit on a good point that the communities really want inclusion from the beginning. From the community perspective and from, at least from our coalition perspective, we know that oftentimes the research is an idea that comes out of an institution, and working in academia for many years, and also and with the community, I realized, and we've heard a lot that communities don't want to be left behind from the beginning of a research idea. And I think that, and then also with the funding directly, giving that funding directly to the community partners. There's this concept called we wrote about this in one of our papers, the capacity paradox, and it's where the government has a perspective that small organizations, because they don't have enough people, can't reach the large masses. And that's actually very different in the communities that we're working with, because a small number of people actually do reach a lot of people, and it's because of the way the work is done. And so as a result, those communities don't receive dollars, and don't get the attention, even if they apply for these national awards, even if they get help from their university or academic partners. Those communities are still left behind. Those community organizations are still left behind. And so one of the things that we have tried to focus on is building that capacity from the federal perspective, so that we can actually increase the visualization of these organizations in our coalition. And I think that's something that the community I hear, often, that we really want, and I see, and we live. The other thing is with the funders, I know that oftentimes our perspective is that we like to be partners with the funders. And so oftentimes it's an RFA came out, but what is the goal of that RFA? Why did they put it out? What is the initiative? What is the core? I was on a call earlier today talking with someone about, what exactly is the importance of this initiative from a high level perspective, from the federal government perspective, from the governor's level perspective in each state, or the president level of an institution. If we understand what it is that the funders are really looking for, it makes us better at putting in applications and being successful.
Well, one quick follow-up, Vanessa. Are you finding the university itself is willing to share resources?
Yeah, so here's what I'm finding. I'm finding in my research, at least, over the past 20 years, and even more recently, I would say in the last 7 years, I am finding that many of the academic sort of, core academic researchers don't have the pathway to communities that they need. They're sort of, kind of bound up in the research and really want to have this be translational, but they don't know exactly how to do that. And so, understanding that these communities are sort of, we want the research to actually be important to us. We don't just want to have research done on us. We want the research to actually be important to the community and be useful to community. They understand now, at least the ones that I have been working with in 3 different states, they understand that you can actually, work with the community from the beginning of thought, and then make sure that that pathway of translation is seamless when you start from the beginning with the community and the resources.
Yeah, thank you. Nia?
Yeah, fully agree. And so I'm gonna move on then into the translation part, right? So many times, so financial help for community from the universities also is important. On top of that, also human resources. So usually when the study is done, who's gonna implement it, especially community really love the intervention, who is gonna fund it? So the way that one of the reasons why I'm at where I'm at is I actually then turn around and help them write grants, right? It become an evidence-based intervention, CDC fund those, HRSA fund those kind of thing, help them get the grants. And then it's actually a natural transition then from a researcher into an evaluator or a quality assurance and quality improvement person. So I do the same. So I do research, but I also do all of the QA/QI for all the federally qualified community health center in the USAPI, right? So, but that's a good thing because a lot of the all the innovative ideas that we have came from those QA/QI projects, because we're, what about this? What about that? So it's this complete circle all the way from getting the idea from them and go all the way through and come back and make sure, and also being part of the QA/QI, team that go in and provide training. You also get to know what needs to be adjusted and all that. And then funding then go to community that are non-research related funding. And that's how they know you really are a good community partner, because you always hear you only come here to do your research, but we're not just there to do the research. We want to make sure it carried out all the way through. So I think that's one way that community want to see us. Actually, funder also want to see us that way also, because we have funder there, NIH, HRSA, Robert Wood Johnson Foundation. They see us as one as a whole, right? They see us as a community, but also when it comes to funder, we all put them all together. They are also our community partner in the most holistic sense of the word because of that process.
Yeah. And James, you're kind of getting your project going, and you've really outlined some very exciting research questions. But as you approach communities, what kinds of things are they being to be interested in?
I actually have no idea. I'm pretty distant. So I'm up in the coordinating center. The field centers are very engaged with the communities. But, I was reflecting on something that Fornessa said about, there are a lot of scientists out there, but they don't know how to connect to the communities that they want to study, because different set of skills, expertise, relationships. And one way that Mosaic is very unique, most of these studies, they'll sample from like Medicare rolls, or they'll take people who usually enroll in these kinds of studies who are mostly white in most of the cohorts. But even in cohorts that are dedicated to kind of non-white populations, the approach is still kind of convenient sampling. One thing that's really unique with Mosaic is leveraging the experience of the investigators working with the communities directly, right? So let's say you wanted to do a big study and say, what's the prevalence of hypertension or, diabetes or something like that in all of the Korean Americans in the US. You might think you can just knock on doors or, take a Medicare roll and get people to reply, but they're not. They're going to say, why are you knocking on my door? Well, what is this study? I don't want to participate. And the answers you get are not going to be the ones that are correct, right? You need engagement, and that takes a lot of work and experience. So one benefit I see is people like me who are used to kind of studying these biological hypotheses, being able to take these questions and study them and implement them in communities who really need to be studied, who are just vastly understudied. And it's only possible because the field centers that are actually recruiting participants and working with them have been doing this work and know how to do it. They do ask their communities, what are you interested in? You know, what are your health concerns? What kinds of questions do you want answered? So, you know, I think I'm a physician too, and I think, you know, patients come in with their complaints and they say, can you fix this? What's going on? But then in the back of your head as an internist, I'm thinking about all the things that they probably don't want to talk about, but I still have to deal with, like their hypertension, their lipids. There are things like that that aren't fun, that don't make them feel bad, but I know that by treating them, we're going to prevent heart attacks, strokes, heart failure, things that they really do care about. So there's a little bit of tension between, you know, what does the ivory tower think are the big health issues or disparities that we want to prevent versus what does a community say they want an answer to? And a lot of times those things align, but sometimes they don't. But I think they're all really important questions that are worth answering.
And now, can I just follow up with that, David? Is that okay?
Sure.
I would like to say too that you know, you touched on something too there, and I think that you know, giving the community the opportunity to help the academic, you know, practitioner or the scientist to navigate those questions, and I think has really been helpful. So I think, you know, when we were we're part of, you know, James's study. We're one of the field centers, part of the field centers with the University of Chicago, but the Asian Health Coalition is a partner with the University of Chicago in this. And so we came together to write this proposal. We didn't hear about it later as the coalition. You know, that was, we helped draft the narrative, and I think changing the narrative on what community groups and community members are willing to do to be part of these studies is really a big education piece. That's a really high, you know, learning curve that has to change in terms of the academic perspective. Is what are communities willing to do to be part of these things from the beginning? And a lot of times, you know, first thing people think is, well, we want money. Well, we do. We need money, you know, to do the work that we're doing, but we really want impact. And so if you start off wrong, you're going to end wrong. You know, one of the researchers that I've enjoyed working with for many, many years, Dr. Helen Lamb, who's at University of Chicago, she says, you know, to me, you know, no data, no problem. You know, if you don't have the right information from the beginning, then you have no problem, right? You know, then nobody knows that there's a problem. You have to start with the messy stuff, as Nia said. So I think that that's really important. The second thing is what Nia said earlier, which is about, you know, and I think you were getting to that question too, is about, you know, sustainability. You know, people don't live their lives on 5-year awards. You know, you know, people's lives are continuous. You know, and just because the institution starts something doesn't mean you can stop it in 5 years. And you know, so starting this conversation from the beginning really helps to make that translation a whole lot better for the community needs.
Yeah.
Can
Sure.
I follow up on something that you said?
Sure.
You know, as I mentioned, I don't have deep experience working with Asian American, Native Hawaiian, or Pacific Islander communities, but I do work in other settings. So, for example, the Jackson Heart Study is the only NHLBI-funded cardiovascular cohort in just Black adults, and it's a very important study. But it's one site in Jackson, Mississippi. And one thing that they do really well is engaging with the community there, not just the participants, but the community. And they ask, you know, what are you interested in? What are you excited in? And that has paid off so well in terms of participants being eager and excited. So the recruitment rates are very high. And we have ancillary studies. So for example, one of the things I study is atrial fibrillation. And we can do things where we put these little patch monitors on for 2 weeks, and you get a lot of information on heart rhythms, including atrial fibrillation, a very important heart rhythm issue. And they love signing up because they know what it is. There's engagement. They want to get these answers. They get clinical reports like they would if they went to their doctor's office. And I think that kind of community engagement makes the science more successful too. And you know, I know this panel is focused more on the community approaches, but I love bringing in the scientific issues too. You know, I don't necessarily care about atrial fibrillation by itself, but I think it's a great example of a health condition that if you don't look, you'll never know. You know, this is one of those things where most of it, people never know they have it, right? Some people have really fast heart rates or really irregular rhythms and they know they're in it. But most of it out there, people go in and out and they never know. And it's one of the most potent and important treatable risk factors for stroke. So doctors really care about this. If we find it, we put people on blood thinners. And for a long time, people thought that Black adults did not have much AFib because the studies using existing methods and existing data said they had half the rate as white adults. When we actually did cardiac monitoring and used unbiased measures, we found actually it was the same. So it's a great example of what Fernessa said, if you don't look, you don't know. And in these Asian American, Native Hawaiian, Pacific Islander communities, there are a lot of assumptions that, oh, they have this or they don't have that, but actually we don't know. And we have to apply rigorous methods, kind of state-of-the-art methods, and really get an answer, because a lot of the prevailing thought about the health of these communities is based on incomplete research.
Terrific, thank you. So let me ask about a question that is often talked about in community engagement, is the dissemination of our findings. What seems to work best from your perspective, Fernessa?
So I think that what we've been talking about this, kind of in this conversation, but it's really being inclusive from the beginning. If anything I've learned over my career working with communities, it's having voice, and the ability to actually, drive things, having people listen. It's you can't, I know this, we're preaching to the choir here, but you really can't, you can't quantify the amount of time that it really takes to become a trusted partner. I mean, I am not Asian, but I've worked in this space for more than 20 years. And it's just, you have to be, a trusted partner. But the thing that I think is important about that is some of the research that we're doing with All of Us Research Program, for example. I mean, this database is very large now. We have more than 22,000 people who are enrolled that identify as American, Asian, Native Hawaiian, Pacific Islander. We have more to go. But we know from our own research that people in the database right now are, more high literate. They have, they're younger. They're not fully representative of the populations that we're trying to reach. And so what we did is we developed we have two cohorts of this, community scientist cohorts, research cohorts. And what we do is we have individuals who are from our national partner network, who are interested in doing research with the database and the data that we have within the All of Us Research Program. And we've produced, manuscripts together. We're working on 2 additional manuscripts, so all of that's happening together with the community partners, coming with the questions. What questions do you have of this data? How can it be important, to us right now? One of the papers that's being worked on right now is the differences in anxiety and depression diagnosis from their EHRs versus what their personal, self-report surveys say. So there are discrepancies there, and why? They're looking at cultural competency and mental health for the healthcare, for people who are working in healthcare, and how to look at how to create cultural competency for the individuals who are working with these populations coming in. How can they better, serve these groups from that perspective? So bringing the community in from the beginning. Again, it's the same narrative in that no matter where you go, but that's what makes that translates the research into work that they can do because they're doing it.
Perfect. How about you, Nia? Anything you might want to add to that?
Yes, yes. So I think it is important to bring community in the beginning and the end, but a lot of time for those of us that's been here for a while, the beginning is the end, right? So any one research at another and all of that. And the cycle that it continues like all the way through. So, and also to thank our Pacific Island community, we're very relational, right? So, a lot of time, we're like, well, we gave them $50 gift card for whatever else, right? Okay, that's a transaction. Don't stop. We'll take that. However, there's other way for us to say thank you, but also engage them that you're now part of the process, right? So one way we do it is like now I think COVID-19 we stopped. We do have the Pasifika Health Gathering. So it's a health gathering of researcher implementers, like a lot of Department of Health, Ministry of Health, nonprofit organizations, and policymakers. So we had it here in Arkansas, Hawaii, Utah. The next one is going to be in Alaska. So we have a large Native and Pacific Island community in Alaska. So they're coming there. But before we were focusing on research dissemination, but it actually evolved. More than half of our researchers, our community, were now implementing projects that these researchers did, and then they're presenting their QA/QI projects, right? In using research methods and all of those kind of things. But I think the other thing that's interesting of the group that are coming in are actually clinicians and physicians, because they're coming in and listen to the issues because I'm also the lead for APIAHF, our health equity primary care center, primary care excellence for Pacific Islanders, right? Because we keep on hearing from our clinician, they're also out, you know what I mean? They're like, we have to read in a paper to know more about what's going on in your community. It's a lot more meaningful if they're sitting there listening to innovative stuff that our community are saying, and not just from here in the continent, Hawaiian and the Pacific Islander. We also work with our international partners like Aitaoto, New Zealand, and then Australia and other part of the Pacific, the same ethnic group, but they have different colonizers. So, but we do have a lot of things in common. So I think having that area for dissemination is also very important in coming up with new ideas, but then also for the clinicians from whether you're a primary care doctor, endocrinologist or whatever else, in a 3-day, because it's a 3-day conference, you're going to hear perspective from many different people from many different areas and all age groups. So I think the one in Utah, we even have a science fair, Pacific Islander student science fair, talking about their health, and they were presented it there, all the way to the elders that use storytelling styles to talk more about breastfeeding or something like that. So it's a wonderful space that originally was created for research dissemination, and I'm happy to say that the community fully take it over. We still have research in there, but they have the beauty of bringing everyone together. So, but the only bad news that I have is that the registration was open on Monday 3 weeks ago, and it was closed on Wednesday because of because it's 350 rooms that we have. But I know I did save some seats. Some people were like, save my seat, because I have to submit my request to the federal government organized. So I do have some seats available because we want to make sure we have representations from some of the researchers that we haven't met before or whatever else. So give me a call, because we do have, but the registration is actually closed. But we need more research groups to come in and listen. I think that's one of the gap that we have. Yes.
Could I
How
ask
many
a
people usually come?
350, 400.
Wow.
It depends on the room. Like sometimes I think at one point we had 500, but the hotel conditioner in Anchorage we're maxing it out at 350, maybe 400 if we do Airbnb and all of that stuff. So it's all that thing. So we're very excited. The other thing about that gathering, we also do regional gatherings. So for the USAPI region, we had it in Palau, the Republic of Palau. So we had that in the Rock Islands, and then for the continental US. We had it in Washington, D.C., because our focus there was policy. So we actually met 40 state legislature, talk about the importance of research and studies and program for Pacific Islander, and then go to talk to your senators about it, right? That's the other group that we need to talk to. And then the third one was supposed to be in Hawaii, but then the Maui fire happened and all that. So it didn't happen. But so how we're doing it now is like we have every other year, we do have a national conference, but all the years in between, we divide it up into region because we also have regional, issues, but we also are supporting local. So we want to make sure each state have their opportunity to huddle and before they come up. So that is one way that we are disseminating our information. Oh, you're on mute, David.
I got frozen for a little bit, so I'm not sure, James. I cut you off. Did you have a chance to ask your question?
Oh, yeah, I wanted to ask Fornessa and Nia. So, in a lot of the other cohorts, if we have some major findings like a new discovery, like, oh, this is a new risk factor or something like that, we'll have newsletters and we'll kind of share information. I was wondering, just for my own benefit and to learn about maybe different approaches for the Mosaic cohort, what you've done in some of your other studies, like if you have a new discovery or finding from the research you've done in your participants, how have they liked to hear about that? Or do you have any stories you can share?
We do it all. I think we had a couple of TikToks that goes on if that's the group that we want to reach.
That's great.
And all of that. We also, I think Facebook is like, what I mean? That's a lot of our Pacific groups. I mean, they love Facebook because they're connected with each other. So we usually put it there. I think we also have a Umu Talk. So it's a group of community health workers that huddle, every month, it depends on who's available. They will come in, but that's a really good way. So if we have a hot topic like that, we actually put a notice up and said, like hot topic coming up, everybody show up. And it's amazing where, in some meetings that we have like 300 community health workers want to find out what the scoop is. And they will come in representing all of these places. And then we can invite the investigator to come in. So it's not just that piece of paper that goes out. In the past, we did release things like that, but also invite the organization or the institute to come in and be available for question and answer. And also we want our community, especially our community health workers, to actually know that person, like see, oh, I saw the guy here, or things like that, make it more personal, and then also be available for questions and things like that. So I think in the past, and then that's a group where the younger groups they did TikToks, and then people post things online, like on Facebook, and then Instagram, they will put it up. But also we incorporated that into their local Talanoa session. So in our group, we like to meet in groups on a local level and have discussion session. So we usually put in a topic, and that's a way for community to reflect on what you said. Like, you heard this is a new thing. What, how do you see it? If it's an intervention, how you want to implement it here, what other questions that you have and whatever. So the opportunity to have a conversation on so many levels is what's working for us. And we're always looking for new partners to have conversations with.
Yeah, I would just say ditto to that, and I've even stole some of your ideas now, Nia. So but I would also say that when we're trying to address some of the issues, nationally, since we're trying to reach so many, and like she said, Facebook and all of these, TikTok and those things. But I think also for us, we develop an education around what and then we vet it with certain community members first to say, hey, here's a new topic, here's something that's coming out, here's something that's relevant to our communities. How is it going to be best to approach these different communities about this topic? So we develop that. We it goes through a couple of iterations, and then we're able to actually disseminate and disseminate that in local settings, but also we try to host at least one or two national settings, platforms like this, to say, here's this new thing that we found out, or here are these new parts of research that we found out. But we just go through that a lot of iteration. in terms of vetting. We want to make sure that it's exactly, not exactly, I mean, we're going to make mistakes, but that it really does come from a community perspective, even though it's something that we want to disseminate maybe from a research perspective. So we go through that iteration process to develop that type of education and then deliver it in settings that are comfortable for each member.
Great, thank you. I've already got the warning that we have to end our little session. We could go on and on, I can tell. It's been a great discussion among the three of you. And then later on in the conference, I'll give a TikTok demonstration on how to dance and disseminate
Oh,
findings.
thank you. We were hoping for that.
I'm just kidding. Anyway, so are there any questions or comments from the audience? Let's see. I don't see any in the chat. Kiana, any? Or Jennifer? One question comes up, I guess I'll ask all three of you. What are some of your upcoming research? It's not what you've done, it's what you're gonna do soon. So,
Hi, Lacey. I heard, I see it's from Elise. Hi, Elise. It's good to hear your question, and I miss seeing you, so we've got to plan to meet together again soon. I think the thing that I'll share is that from our community, I think one of the things we're working on is increasing the amount of knowledge around cardiovascular issues with populations that have not had this opportunity in recent years, at least in the Chicago area. And so we're working with some researchers from Penn State College of Medicine, which is not in Chicago, but the goal of the research is that we model it after education. So we're going to be training the providers and the cardiologists on issues that surround cardiovascular disease in these different communities in Chicago. And then we're going to do that through the Project ECHO. And then we're going to have them work with the community health workers after the community health workers have also received this training. And they're going to be co-presenting, co-delivering education over a period of time. And then we're going to be watching markers. One of the things that we're going to do is we're going to model it behind one of our programs called A1C, or All One Community. That's what it stands for, and it actually has all of the family members. So anyone with a marker that has a cardiovascular issue, high A1C or high, cholesterol, then the whole family actually gets enrolled in the project. And so we see that all the community is actually enrolled as opposed to one patient out of a family. So that's one of the upcoming pieces of research that we're going to be doing.
Perfect. Nia, you have so much going on.
I know there's so much. I just think so something that I think is very different for me is this. We have a researcher that's looking at maternal child health from the culture perspective. The term itself, maternal child health, does not include the father, right? So we've been including men outside of a lot of our intervention, and that's why when we call them to come in, they don't come. So we're looking at that, looking at child health and maternal, but then look at the role of men in health. So I think it started out of that conversation, but then that group of men actually decided to, they want to submit a proposal on men's health and heart. I think heart is an issue from what is their perspective of what they can do about it and all of that. So we do have in several areas in our different states, there are men's group. Like here in Arkansas, we have Einaman. It's a group of men that get together and look at their health, and then incorporate that into the overall health. So we're not just looking at in maternal child health, we also look at the father. So that's an exciting thing, to engage more men into research and healthcare and all that. So it's exciting.
Yeah. James, you have enough to do yourself.
Yeah, well, I
Uh,
mean, things are busy just planning the first Mosaic exam, and I didn't really share what's in it. It's going to be a combination of a lot of surveys to capture just important information about medical history, risk factors, social determinants of health, kind of lifestyle, physical activity. These surveys take a few hours to do, but then also some kind of more clinical measurements. So things like blood pressure, ECGs, spirometry. But that's really kind of the starting point. Because this is a platform where we can add additional studies. Many of us are writing grants. I just submitted a grant to study atrial fibrillation, so to do cardiac monitoring. Others are proposing, body composition with DEXA, echocardiography, things like that. So for me, it's more kind of building on this amazing new resource and trying to add new measurements. Because when you add all these measurements, people come up with great hypotheses and things you can't do just with a single measurement.
Thank you. One question from the chat is, what else can we do to encourage more Asian Americans, Native Hawaiian, Pacific Islanders to join the research workforce? And what more can be done to promote representation in leadership roles in research, funding, journals, etc.? Vanessa,
Yeah.
you want to start
Yeah,
that?
I saw these, and I was also looking at the other question that's there too, because I'm familiar with some of the research that has been done there. But yeah, I was just thinking one of the things that we are doing is we are working with the Asian Pacific American Medical Students Association, APIAHF, and they have been. We have had medical student ambassadors as part of our project or our program for the last 4.5 years. So what we're doing is we're really trying to start conversation early on about and connecting these students with communities from the beginning. And so it's been an amazing partnership. So really that's sort of the pipeline, right? Then the other thing is, I think, just to hit on what James was saying earlier, that, researchers might have this interest, but they may not know how. So they may be interested in, academic, professors, people who are studying things may be interested in doing more research around with communities, but that pathway is not yet, sort of created for them, or they're not funding available, which is oftentimes the case, that will be inclusive of the communities that we're trying to also work with. So I think that it's my job as a community partner, but also as an academic, to really bridge those gaps and bring those people in early in the pipeline, and also bring them sort of, as I've done with several researchers actually this past year, bring them out of retirement, and say, hey, don't hang up your research yet. We need it in the community, and helping them figure out that pathway.
Perfect. James, any thoughts?
I was looking just at the questions. There was one about what can we do to encourage more Asian American, Native Hawaiian, Pacific Islander individuals to join the research workforce and promote representation. I don't think we actually touched on that, but that's an important issue. One thing I've noticed in medicine and academia, but also in science, there's not necessarily a underrepresentation of some of the Asian American groups, but very few of them are leaders, deans of the medical schools, chairs of departments. And that's true in clinical medicine too. So I think that's a just broader problem. But just as far as getting people more involved, I think having visible studies that are talked about, that are funded well, that are active, that are vibrant, attracts people to study it. Because if you have a young a student or investigator who's eager and trying to figure out what are they going to dedicate their career to, there's all these opportunities to work in a laboratory or to study lipids or something in some of these other cohorts, but you don't have a way to study Native Hawaiian health or Asian American health, where they are, then they don't do it. So I think creating these opportunities is key to increasing representation and getting more of these people who look like the communities they're trying to study, actually leading the research. And I think that will optimistically improve over time.
Thank you. And Nia, you had the first word, so I'll give you the last word.
So for us, we need to think outside of the box around workforce, right? Because we find that a lot of good researcher may come from the School of Nursing, right? We have a lot of nurse practitioners and PhD nursing that actually are for Native Hawaiian Pacific and are very interested in doing research. And then also, I think for Pasifika students that are in college right now, it's also good for them to see, and they want community work. Just like me, I was in academia, I want to do both and all of that. They want something tangible for their community. That's something that's innate in us. But then for us then to develop a system, a research system, what do you call it, research industry, to have something that is attractive, that actually touch that part of their soul, that make them want to go to school in the first place. So, and I think that's what we're doing, right now with all of our work. We're trying to figure out how to make our research relevant to the future researcher, not just the research in itself, right, to move forward with community, but also to encourage and then inspire future researchers to come in, because this work it's ongoing, even after us. And I think also be available as someone who's in community. We need to make ourselves available and prioritize mentoring the next generation, right? So in recruitment or whatever else, like have our organization open. So look at funding. It's not just the NIH or responsibility. Look at the way HRSA and then CDC do their programmatic funding, right? There should be funding for evaluators that are researchers, so they can have that part of their time to be in community. So looking at, be innovative a way that we are going to build that. And that is one of the priority of where we're at NAOPO and the Pe'aolewasa, is looking at ways to be innovative and get more Pasifika students in and be interested in research.
Perfect. Thank you. Nia, James, Vanessa, terrific panel sessions, great ideas. And again, this is the beginning of us observing and watching and looking forward to your work. And then hopefully people from this conference will become engaged and ask to participate as well. You guys are not only terrific researchers, but wonderful mentors, and we just look forward to the great work that will be continued to do. So thank you. And Jennifer, is that it?
That is, thank you, David, for moderating so smoothly. And thank you, Nia, James, and Vanessa for really driving this important dialogue this afternoon. It's been really engaging. We do have to wrap up for the time being, but hope to continue it offline and elsewhere, since it's not a conversation that has any easy answers or clear next steps, but we're all working together on it. So please join us at our next session, which is happening momentarily. And I just added the link to sign up for it if you don't have the link already to join our next session. But thank you all for your time and have a good afternoon.
Thank you.
And look for my TikTok.
Thank you. Bye-bye. Thanks, everyone.
Bye.